The Department of Health in Gauteng has urged parents and guardians to sign consent forms for their children to be vaccinated against measles. Officials are stepping up their campaign to immunize those up to the ages of 15 after an outbreak in 5 provinces. 15 confirmed cases have been reported in Gauteng since October. We speak now to the department's spokesperson, and that is Motalatale Modiba after this. Okay, Mr. Modiba, thank you very much for availing yourself this afternoon. Perhaps an overview of where we sit countrywide in terms of infections.
I don't think I have the stats now for countrywide, but for Gauteng, we're still remaining at 15 confirmed cases. But we have intensified our campaign in terms of reaching to communities, and also now that the schools and the early childhood development centers have opened, we are also aggressively targeting those, and we have seen a sharp rise in the numbers of those that are now immunized. We have since now immunized more than 141,000 eligible children, and we know that this number, obviously, once the team collate the stats for this week, is likely to rise because we've been on the ground, we've been visiting various schools, we've been on going to different communities, basically raising the awareness on the importance of immunizing our children, and also just educating them on just basic awareness so that we allay fears as well around the immunization of children. But it is important that obviously we get the message, we educate the public, and with the schools, we even have to obviously engage with parents, ensure that there is consent from guardians, from parents ahead of us immunizing their children.
Yeah, the awareness campaign, especially when you speak of educating parents and allaying their fears as well as caregivers, in trying to understand whether the message is indeed reaching people, what is your target? You speak of over 140,000 children already being immunized. Do you have a specific target that you can benchmark against?
Look, in Gauteng, we've got, I think, just about 4 million eligible children. That is children between the ages of 6 months to 15 years that are eligible for them to get their immunization for measles. And therefore, we're aiming for a 95% reach. We know that it's a steep target, but it's something that we're working hard on with we've got ward-based outreach teams on the ground. We've got our community health workers on the ground. We're working with development partners and other structures in municipalities and in the communities where we are doing our campaigns to ensure that we get the word out there. We've even set up, all our health facilities at the moment. They are all offering immunization for measles and for other programs. And we're really calling on parents and guardians to heed the message. It is important that we protect our young ones now so that we can cap the spread of measles.
Is there resistance on the ground as a result of misconceptions?
I wouldn't say it's resistance, but I would say that it's people requiring further clarity, needing more explanations in terms of why is it important and so forth. And just yesterday when we were at one of the schools, I was telling some of your colleagues that, when we were growing up, we would all say, I've been to Gauteng Endo, or I've been injected and so forth, and we have a sign beside. And it really wasn't much of a big deal because it was expected that you would go through that immunization program when you are young to protect you against diseases in future. And I think now that we're living in the age of easy access to information, it means that people also have access to wrong information at the same time. And therefore, the correct information has to always compete with misleading information. And that's why the issue of education in communities, utilizing various platforms. We're utilizing various media platforms, our own platforms as government to strengthen the messaging. We're also working with other institutions and organizations that are doing great work in communities to help us to really spread the message. You know that measles can affect children under the age of 1, and also it can occur in older children, including adults who have not been vaccinated or who have not previously contracted the disease. And therefore, we are heightening the awareness, the education, just to ensure that we don't leave anyone behind. And our healthcare workers, they are actually clarifying a lot of misconceptions and other misinformation that is out there, just so that we build greater awareness. But so far, for us, in the schools that we've been at, in the areas where we've been, it seems like parents are heeding the call, in terms of when we look at the number of children that are actually coming back with consent forms, because I think there is a greater appreciation of the importance of immunizing your young one.
On the issue of consent forms, should a child go back home to a caregiver and they have been immunized without the parent or the guardian giving consent, are there consequences? Has something like that come up?
Of course, by law, you know that there are certain forms of care that children can actually be able to get access to when they are of a particular age, without even getting the consent from parents. But the stance that we've taken, working together with our sister department, Department of Education, was that of being able to engage with caregivers and parents and persuade them. Fortunately, so far, we haven't had many declining, but where we've got instances of people declining, what we do is that we continue to advocate and to share the messages so that they're able to actually respond more positively. We fortunately don't, especially as the schools, we don't immunize a child when the consent forms have not been completed, and that's why we are aggressively going to communities. We're engaging with parents, we're engaging with SGBs at the schools, but also we are taking the campaigns to also even the shopping centers, where we know that over the weekend parents move in those particular shopping centers to further strengthen their awareness. And often what you find is that when they see other children being immunized and actually continuing and going on with nothing happening to them, it begins to then also allay the fears. Of course, we do explain as well some of the maybe side effects, like you're itching on the side, and what to do immediately after being your child has been immunized, how to observe them and so forth, so that we just build more awareness. I suppose the education element becomes very key as we seek to build a greater appreciation and awareness of the importance of, it's not just, by the way, measles that we're immunizing for. There's many other things that we're immunizing for. The human papilloma virus, we immunize against that. We know that when young girls have not gotten their shot, what happens is that later on in life, there's a risk of cancer, cervical cancer actually being contracted and so forth. So it's important, and that's why we keep on emphasizing and educating as much as we can, utilizing all means at our disposal.
Thank you very much. Motalatale Modiba is the head of communications at the Gauteng Department of Health.